Everyone, Ashley with Amare back for another live. Today we're going to talk about pain management after surgery. So there are a lot of things that you can do, and there are a lot of things that people tell you can do for pain management after surgery. But let's talk about first, how much pain are you actually in after surgery and what is there to expect? So some doctors will tell you something as simple as lipo, you'll feel like it was a really intense workout. And then when you guys come into my office, you tell me it feels like you got hit by a truck and beat up with a baseball bat. That's a more accurate description. A really intense workout is kind of like topical pain, but what happens when you actually get surgery, it's internal. So the cannula that they're using to do the lipo, the actual device, is literally going in and cutting you up internally. Sometimes it can go down pretty deep in there, depending on how much you have to take out. Same thing with a tummy tuck. With a tummy tuck, you're getting cut in half. Literally in half. And if you're having an ab repair, your entire stomach is getting cut right down the center or sewed up together internally, and then your skin is getting cut in half. So anytime you breathe, anytime you move, anytime you sneeze, anytime you laugh, it's gonna hurt. And then if you're doing lipo 360 on top of the tummy tuck to the flanks and the back part, that's going to feel really sore too because you're laying on it, because you're not laying on your stomach. So it's a little bit more intense than that. Sometimes, and this is what really depends on how much pain you're in, is if you're getting a little bit of sculpting done versus a lot done. So if you're getting a little bit of sculpting done, just a little bit to the sides, a little bit to the back, same thing with a BBL, you're just putting in a little bit of shaping, it's not going to be that bad. You may feel like it was an intense workout, but if you're in there for 6 hours and they're doing a lot of sculpting and it's a lot of work, yeah, you're going to be in a little bit more pain than that. So what do doctors give you as far as meds? Well, they give you your antibiotics. You got to be on those from 5 to 7 to 10 to sometimes 14 days, depending on what they give you. That's number one. Number two, they'll either give you oxys or perks. Oxys usually make you very, very drowsy and kind of foggy. So oxys and perks don't really stop the pain. They just kind of cloud it so you don't feel it as much. But underneath the oxys and the perks, you're still in pain. You still had surgery. You're still sore. So once they wear off, yeah, you're going to be in a little bit of pain. Usually what I tell my clients is take the oxys and the Percocets right after surgery. Take them for about 2 to 3 days, depending on how intense your actual surgery was, and then try to wean yourself off of them. Guys, use it only if you need it. I cannot tell you how many people come into our office high, so high, off the pain meds, they think they're in 10 times more pain than they actually are. They can work against you, actually mentally and pain-wise. They can work against you if you're taking them for too long or if you're taking them and they're not meant to be taking them. And yes, pain pills can get addicting and a lot of people want to get off of them because of that, but you do need them, especially those first couple days, and especially to sleep. Sleep is the most important thing. If you're not sleeping because you're in pain and you're not taking your pain meds, you need to be taking them. You need to be sleeping. That's how your body's going to heal. On top of coming to see us and getting in the car and moving and getting up and getting around. So usually what we'll say is take your oxys, take your perks, take whatever pain stuff you're taking at night to go to sleep after the 3rd or 4th day. During the first 3 to 4 days, definitely take them as you need them. And don't try to not take them because it's going to make a big difference in the way that you heal. Sorry guys, my cat's in the way. So make sure you're taking those as you need them. But start to try and wean yourself off of them and start to try and get onto the Tylenol PM, Tylenol Time Release, or Tylenol Extra Strength. Those are the things that you need. Those are going to be the things that are going to maintain you. But the biggest thing for getting down the pain is getting that internal swelling out because it's literally pushing on your sutures and it's pushing on all of the areas that you had surgery and it's causing more pain every time you move, every time you breathe. The other thing manual lymph drainage does is get rid of that dead tissue and get rid of the bruising and start to bring in new white blood cells to heal everything. So naturally, with your body, it is going to help you heal and be in less pain because that broken tissue is going to start to heal a lot faster. So lymph drainage is definitely one of those keys to taking down the pain and getting that swelling out that makes you super uncomfortable. That's a huge part of it. So that aside, Tylenol PM, Tylenol Time Release, Tylenol Extra Strength, those are what you should be on. Now, obviously, ask your doctor. That's usually what they recommend 99.9% of the time. So make sure that it's okay for you to be taking those beforehand. Natural things that people will tell you to take. Arnica. Here's the thing with Arnica. Drinking Arnica tea, yes, that works. The Arnica homeopathy, there's a big misconception with this. Guys, those little, sugar pill things that they give you, the homeopathic Arnica, the little blue tube that you guys take, that's just a sugar pill with Arnica essence in it. It's not the actual herb itself. So we want to make sure that we are actually taking real Arnica. The thing with our Arnica cream, which we're going to get to in a second of what you guys take, the thing with our Arnica cream is that it actually has the Arnica plant in it. It's an extract. It's not just the essence of. The other thing is that a lot of the Boreon Arnica, the white tube, the Arnica gel that you use, and the Arnica cream, it doesn't have much Arnica in it. That stuff is more for like, oh, I stubbed my toe, I need a little bit of Arnica. Not, I got cut up everywhere and had serious surgery and need pain relief. That stuff is not going to work. Our cream is extra strength. It's a topical analgesic. What does that mean? It stops pain at the skin. It stops pain right where the pain is. So making sure that you actually have something that's really good that works is one of the biggest things. Arnica does work if you are actually drinking the tea, if you are actually getting the actual part of the Arnica plant, taking supplements that are Arnica, not just a sugar pill. So, or not just Arnica gel, which is mostly just alcohol. And if you were to use the tube the way you're supposed to, which is head to toe everywhere, because it's absorbed transdermally into the skin, which means the more derma or skin that you cover, the higher of a dose of the Arnica you get. If you were to use that tube on everywhere, you would run through a tube a day, and that stuff is like $20. Our Arnica cream is $20, and it's a tub of cream, and it lasts you your whole surgery and then some. So just make sure you're getting the right stuff. Arnica is good, again, when it's used properly. The other thing is bromelain. Bromelain is not pain relief. Bromelain is not pain relief. Bromelain is for getting rid of the swelling and healing the tissue. Bromelain is wonderful. Bromelain is the thing, the enzyme that's in the pineapple skin and the pineapple core. It is in the pineapple, but it's more so boiling the skin and boiling the core is what gets the bromelain. Making a tea from that. That's the way they do it, like in Trinidad and third world countries and stuff like that. So eating Goya pineapples out of a can and having pineapple juice that's sugary AF is not the answer, guys. Make sure you're getting bromelain from the pineapple, actual bromelain. So that will also be a big benefit to you. When you are talking about other kinds of pain relief, like other pain meds that your doctor's putting you on, I've seen some scary things, guys. I've seen some things come out of Mexico and Colombia and DR where you don't even know what you're taking because it's not even in English. And it's supposed to be pain meds, but the entire thing's in Spanish and you have no idea what it is. Please be careful. We don't know what it is. We don't know what it's doing to you. Now let's talk about, other than the pain, the thing that it actually does to your body as far as healing. So the anesthesia, the oxys, the antibiotics, the perks, those will dehydrate you like crazy. Those will cause your body to hold on to swelling. Those will cause hardening if you are not careful. Those will also bog you down like a lot. And again, they warp your mind and they'll make you think that you're in so much more pain. I have literally had people sitting, just like leaning against the table, thinking that they're like falling off the top of a building because it warps you so much. And your adrenaline and your cortisol and all of your pain receptors are already on fire from being in pain. It messes you up. It's insane. So the quicker you can get off of those, the better. But physically, for your body, they're not good, guys. They're not helping. They're helping with the pain, but they're really not helping your body heal at all. So it's kind of actually setting you back. Again, those things will make you constipated. Those things will make you cranky. They'll affect your sleep. If you're taking them for long enough, they will help you get to sleep in the beginning because of the pain and knock you out, but they'll work against you and then they won't help with the pain. You'll just be really high and awake because your body has all of this stuff inside of it. So this is why we make sure that we're coming to lymph drainage, getting your actual lymph drainage detox while we're actually doing the lymphatic massage. Your body is detoxing all that crap. Drinking your water, making sure that you're eating a lot of greens, having the green juice that we give you guys, making sure that you're filtering all this crap out of your body so that you start going to the bathroom. Because if you are constipated and that is pressing against your tummy tuck scar and you're bloated, you're going to be in a lot of pain because you're literally bloating internally on top of internal swelling and it's pushing against your scar or your incision. And if you have internal incisions and all kinds of stuff, even if you just have lipo, it's gonna be, and then you're in your garment and that's pressure and you're constipated in your garment and it's a mess. So guys, just please really be careful with the meds that you're on. Try to switch to something. And some doctors, now again, ask your doctor. We are not doctors. I'm a specialist, but I'm not a doctor. Ask your doctor. Arnica, sometimes they'll tell you to start taking it beforehand. Sometimes they'll tell you to wait until a couple days after, depending on how it affects your body, depending on how it affects the surgery. So ask your doctor about all of these things at your pre-op or even at your consult and be like, hey, what pain meds am I going to be on? Hey, what am I going to be, what should I expect as far as pain? Like, how long do I need to be on my pain meds for? What is the recommended, time that I should be on them for? Because again, they can work against your body, like a lot. This is Cleo. She's obsessed with the camera today, so say hi. But that's really all I have to say about it. Again, garment will cause pain. If your garment is cutting into you, it will cause more swelling and cause more pain. If your garment doesn't fit right or is not tight enough, or the seams aren't cut to hold you in the correct places, it will cause you pain and you will get instant fibrosis immediately, because it's not going to be giving you any proper compression and your skin is going to hurt. And every breath you take and every movement that you're going throughout the day, even just laying down, your garment's not holding you. Nothing is holding you. So you're just kind of flailing and all your pain receptors are going to be on fire for a while, and then you're going to get fibrosis, and the fibrosis is going to hurt on top of that. So making sure that you have a garment that actually fits is also key to that. So I hope this was helpful. Again, we have pre-ops online. I can do a virtual with you guys. We can talk about all this stuff. If you're currently going through an issue, currently having a problem, we can set up a virtual consult and figure that out too. There are always ways to make it better. So I hope this was a little bit helpful for you guys. Remember, first and foremost, guys, talk to your doctor. Please talk to your doctor about all of these things. You cannot just go shooting blind in the dark here. Every surgery is different. Every doctor is different. Every person is different. So please talk to your doctor. Again, this is Cleopatra. I hope you guys enjoyed this. I hope this was somewhat helpful, and I will talk to you guys soon. Bye.